Hi, my name is Angela, and Rashonda, Brianna, and I are here to talk about the healthcare system of Brazil. Before we go into the main part of the presentation, here are some general statistics regarding Brazil. Its full name is the Federal Republic of Brazil and is located in South America. Brazil has a population of over 200 million people, and Portuguese is the most commonly spoken language. Here are some financial statistics for Brazil. Brazil has a gross domestic product of $2.4 trillion. The gross domestic product is the total value of goods and services provided in a country in 1 year. Brazil keeps losing money due to people dying of chronic conditions such as diabetes, stroke, and heart disease. These are the three most common chronic diseases that the Brazilian patients are diagnosed with. They have lost $49 billion in the last 10 years due to people dying, and it is expected that they will lose $3 billion more in the coming years. So, what type of healthcare system does Brazil have? They have a unified health system called Sistema Único de Saúde. It is comprised of public, private, and supplemental insurance. The Ministry of Health is the body of government responsible for the management and regulation of the healthcare system. Here are some facts regarding the healthcare in Brazil. In order to receive the health care, a patient must prove that they were born in Brazil and have a taxpayer ID. The patient must receive a card from the government. This card is used electronically and patients can go anywhere in the country as long as that hospital or provider is in the network. Patients can access their medical records with this card from anywhere in the system once they are enrolled in the system. There are many comparisons between the United States and Brazil. The first one is, in Brazil, most health care is free, but because of that means longer waiting times because everyone wants or needs health care. On the other hand, here in the United States, we pay deductibles and premiums for our health insurance and still have to pay co-pays when we have medical procedures performed. Those patients that cannot afford to pay all of these costs or have medical conditions that prevent them from working get placed on a government program such as Medicaid or Medicare. Another comparison is that because the health care in Brazil is free, they have to make cuts elsewhere. Their hospitals suffer. Brazilian hospitals are not technologically advanced, have no amenities for patient care such as air conditioning, and are dirty due to no one to clean them. The U.S., on the other hand, is receiving all of this money from all of the insurance companies and patients, so they have all kinds of money to keep up with the latest technologies and latest treatment options. They can hire people to keep the facility clean and have amenities for patients and employees' comfort, such as air conditioning. Another comparison is that both Brazil and the United States place a high priority on preventative medicine. They want to stop diseases before they get bad or treat patients to live right and fix their risk factors before something happens.
Thanks for the introduction. So, to better understand the healthcare status of Brazil, let's take a look at a few of its core health indicators. Well, actually, let's define what a health indicator is. The National Institute of Health defines an indicator as a type of measurement which provides evidence that a certain condition exists. It tells how well specific results or objectives have or have not been achieved. And they are also very important since they allow decision makers to assess progress towards intended outputs, outcomes, goals, and objectives. Indicators typically fall within 4 domains. You have health status, risk factors, service coverage, and health systems, each of which has various subcategories. The following charts and graphs will depict a few of the outcomes for Brazil's health indicators, or some of Brazil's health indicators. One indicator is life expectancy. Life expectancy for both genders in Brazil is currently around 74 years of age. This number has slightly increased over the years as the nation continues to develop socially and economically. Another indicator that shows the success of change is the mortality rate for children under 5. In 2015, the mortality rate was 16.4 infant deaths per 1,000 live births. This is a substantial drop since 1990, in which the rate was 50 deaths per 1,000 live births. This drop strongly suggests that the changes Brazil has made to its healthcare system have had some positive effects. The next graphs also represent mortality rates. However, on the left, you have age-standardized death rates of chronic illnesses by gender, and on the right, you have proportional mortality of all deaths within Brazil. On both graphs, cardiovascular disease is the #1 cause of death. It's also the one that's depicted in red. Cardiovascular disease is also the #1 cause of death globally. In 2012, an estimated 17.5 million people have died from cardiovascular diseases. Related deaths represent about 31% for both Brazil and worldwide. Over the past 2 decades, Brazil's healthcare system has implemented various new technologies, programs, policies, and laws addressing health indicators. However, struggles have existed due to a lack of technology. To encounter these implications, Law 12,401 was implemented. This law addresses how the public health system will incorporate and use new technologies. The Department of National Committee for Health Technology Incorporated was created because of this law. Since its inception, 110 new technologies have been incorporated. Another area for improvement is clinical research. Clinical research is also needed to better measure and identify healthcare indicators and outcomes. The World Health Organization currently insists that countries cannot manage what they cannot measure. So with the proper balance between research, the use of advanced technology, and continued implementation or evaluation of various programs and laws, Brazil may be able to continue its improvement in healthcare and outcomes. Up next.
The next topic that we have is access to healthcare. Access to healthcare in Brazil is a big struggle. The people of Brazil have most difficulty finding access to specialized healthcare services and diagnostic tests. Some reasons why access to these services are difficult include not having health centers in remote areas, healthcare centers having high staff turnover rates, and Brazil's finances causes trouble because it is difficult to find cost-effective medical procedures and treatments. The country of Brazil does support research and innovation. However, even though the country is in favor of research and innovation, due to their finances, it's not always an option. Despite the country's finances, Brazil has been able to do very high-quality research on the topic of illicit tobacco trading. This was very well-known research that was presented at the United Nations. Brazil is very passionate about this topic because lung cancer and heart disease are some of the most common chronic diseases in the country. The last topic that we have is how effective Brazil is at measuring healthcare outcomes. When it comes to measuring healthcare outcomes, Brazil has had some trouble. This is because of some of the previous mentioned problems, including healthcare access, healthcare providers being so spread out, and the financial state of the country, which hinders them from participating in research. One main thing that contributes to not being able to measure healthcare outcomes is not having enough workers to concentrate on specific topics. This concludes our research on Brazil. Thank you for watching.